Amlodipine, a calcium channel blocker, has been widely prescribed for managing hypertension and angina. It has been a go-to medication for many individuals looking to control their blood pressure or reduce the discomfort associated with these conditions. But what many patients don't realize is that every medication comes with its own set of potential side effects and interactions. That's why it's crucial to be well informed before starting any new medication. And today we will reveal everything you need to know about amlodipine, including its uses, benefits, warnings, side effects, dosages, and much more. So if you're considering taking amlodipine, make sure to watch this video till the end. What is amlodipine? Amlodipine belongs to a class of medications known as calcium channel blockers. It works by relaxing the blood vessels, which lowers blood pressure and improves blood flow. This mechanism of action makes it effective in treating various cardiovascular conditions, including hypertension, coronary artery disease, and angina. What is amlodipine used for? Amlodipine is primarily used to treat high blood pressure, also known as hypertension. By reducing blood pressure, amlodipine helps prevent complications associated with hypertension, such as heart disease, stroke, and kidney disease. Additionally, amlodipine is used to manage angina, a condition characterized by chest pain or discomfort due to reduced blood flow to the heart muscle. Amlodipine helps alleviate angina symptoms by improving blood flow to the heart. Furthermore, amlodipine may be prescribed for other purposes, as determined by your healthcare provider. What are the brand names and forms available? Amlodipine is available under various brand names, including Norvasc, Verapamil Senior, and amlodipine and benazepril HCTZ combination products like Libtril. It's available in different forms, including tablets and oral solutions. The specific formulation and dosage strength may vary, depending on the brand and indication of use. What are the possible side effects of amlodipine? While amlodipine is generally well tolerated, it's essential to be aware of its potential side effects. Common side effects may include dizziness, lightheadedness, headache, nausea, fatigue, and edema, especially in the lower extremities. In some cases, amlodipine can cause more serious side effects, including an increase in heart rate, palpitations, hypertension, constipation, diarrhea, and abdominal pain. It's important to note that not everyone will experience these side effects, and the severity can vary from person to person. However, if you do experience any concerning symptoms while taking amlodipine, it's crucial to consult your healthcare provider. Can amlodipine cause weight gain? Yes, amlodipine has been known to cause weight gain in some patients. Weight gain as a side effect of amlodipine can be attributed to several factors. First, amlodipine can cause fluid retention, leading to water weight gain. This occurs because amlodipine relaxes blood vessels, which can cause fluid to be reabsorbed rather than being eliminated through urination. Second, amlodipine may cause an increase in appetite, potentially leading to overeating and subsequent weight gain. However, it's important to note that not everyone will experience weight gain while taking amlodipine, and the amount of weight gain can vary. If you notice significant weight gain while on amlodipine therapy, it's essential to discuss it with your healthcare provider. How should you take amlodipine? Amlodipine should be taken exactly as prescribed by your healthcare provider. Typically, it's recommended to take amlodipine once daily at a dose of 5 milligrams. However, the dosage may vary depending on the indication of use and individual patient factors. It's important to note that amlodipine is available in different formulations, including immediate release and extended release. Your healthcare provider will determine the appropriate formulation and dosage for you. For patients who have difficulty swallowing tablets, an all-solution form of amlodipine may be available. Consult your pharmacist or healthcare provider for guidance on switching from tablets to the oral solution. What happens if you miss a dose of amlodipine? If you miss a dose of amlodipine, it's important to take it as soon as you remember. However, if it's almost time for your next dose, skip the missed dose and continue with your regular dosing schedule. Do not take a double dose to compensate for a missed dose. What happens if you overdose on amlodipine? An amlodipine overdose can lead to various cardiovascular side effects. These can include low blood pressure, bradycardia, which means a slow heart rate, cardiac arrest, which is when the heart stops beating effectively, and even death in severe cases. Other potential side effects of an amlodipine overdose may include dizziness, lightheadedness, headache, nausea, vomiting, palpitations, and edema. If you suspect an amlodipine overdose, seek medical attention immediately. Is amlodipine safe during pregnancy and breastfeeding? The safety of amlodipine during pregnancy and breastfeeding hasn't been established. Animal studies have shown that amlodipine can cause adverse effects on the fetus or newborn. As a result, amlodipine should be avoided during pregnancy unless the potential benefits outweigh the risks. Regarding breastfeeding, it's not known whether amlodipine is excreted into breast milk. The decision to use amlodipine while breastfeeding should be made by your healthcare provider based on the potential risks and benefits to both you and your child. Can amlodipine cause hair loss? There is limited evidence to suggest that amlodipine can cause hair loss. Hair loss is a common concern for many individuals, and it's understandable that people would want to know if their medications could potentially contribute to it. However, it's important to note that the available research does not establish a direct link between amlodipine use and hair loss. If you are experiencing hair loss while taking amlodipine, it's essential to consult with your healthcare provider. They can help determine if amlodipine is contributing to your hair loss, or if there are other underlying factors involved. Which medications can interact with amlodipine? Amlodipine can interact with other medications you're taking. These interactions can affect the effectiveness of the medications or increase the risk of side effects. It's crucial to inform your healthcare provider about all the medications, including prescription and over-the-counter drugs, as well as any herbal supplements you are taking. Some medications that can interact with amlodipine include digoxin, rifampin, and grapefruit juice. Grapefruit and grapefruit juice can increase the levels of amlodipine in the body, leading to increased side effects. To avoid potential drug interactions, it's important to avoid consuming grapefruit or grapefruit juice while taking amlodipine. What foods should be avoided while taking amlodipine? While amlodipine itself doesn't have specific dietary restrictions, it's generally recommended to follow a heart-healthy diet regardless. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins is beneficial for overall cardiovascular health. Additionally, it's essential to monitor your salt intake while taking amlodipine, as excessive salt can increase blood pressure, potentially counteracting the effects of the medication. Your healthcare provider may also advise you to limit saturated and trans fats, as well as cholesterol, to maintain healthy blood pressure and reduce the risk of cardiovascular diseases. What should you do before starting amlodipine? Before starting amlodipine, it's essential to consult with your healthcare provider and disclose your complete medical history. This includes any pre-existing conditions you may have. Additionally, you should inform your healthcare provider about all the medications and supplements you will be taking to ensure that amlodipine is safe and appropriate for you. Your healthcare provider may perform certain tests to assess your kidney function and overall health before prescribing amlodipine. It is also crucial to be aware of the potential side effects and interactions of amlodipine and discuss them with your healthcare provider. They can provide guidance on how to manage these issues if they arise. What should you know about storage and disposal of amlodipine? Amlodipine should be stored at room temperature away from moisture and direct sunlight. Keep the container tightly closed when not in use. The specific storage conditions may vary depending on the formulation. Always refer to the instructions provided on the packaging, or consult your pharmacist if you have any concerns. When disposing of amlodipine, it's essential to follow local regulations and guidelines. You may contact your local waste disposal authority or pharmacist for guidance on safe disposal practices. Never flush medications down the toilet or throw them in the regular garbage. Before we wrap up this comprehensive guide on amlodipine, it's crucial to emphasize the importance of personalized medical advice. While this video provides valuable insights and information, it's not a substitute for professional medical guidance. Every individual is unique, and what works for one person may not work for another. Therefore, it's essential to consult with your healthcare provider to determine the appropriate treatment plan for you. Remember, your healthcare provider has the necessary expertise and knowledge to consider your specific circumstances, medical history, and potential interactions with other medications you're taking. Don't hesitate to ask questions and have an open discussion about your health concerns. By working together, you and your healthcare provider can make informed decisions regarding the use of amlodipine or any other medication to help you achieve your health goals. Thank you for watching today's video. If you found the information helpful, please give it a thumbs up and share it with anyone who might benefit. Stay healthy and take care.